to invite you to address us and officially release the 3 patients to go home, and also request the health workers to go and continue with their duties. I thank you, and God bless you all.
Thank you, our lovely Honorable Minister for Health. Before the Right Honorable comes, I will request the team leader, COVID-19 Entebbe Regional Referral Hospital, to present certificates of those people who are going to be discharged before the Right Honorable begins his remarks. Thank you.
Thank you very much, Dr. Nsereko. Honorable Jane Acheng, the Minister of Health, Permanent Secretary, representative of World Health Organization and representative of CDC, Dr. Mwebesa, Director General of Health Services, the Director of the hospital, Professor Kalebo, the health workers of Entebbe Referral Hospital, friends. This is an extremely pleasant function amidst a difficult situation of fighting a war against COVID-19. I want to take this opportunity, therefore, to salute the grassroots and frontline workers who have been making sure that these patients are given tender loving care, good clinical care, and now they have graduated to where 3 of them are being discharged today. We should all clap our hands for these health workers. I thank the director of the hospital, who has kept the hospital, I must say, in a good shape and looked after the patients and created a good environment. I also thank Dr. Nsereko. He educated us quite a lot about the clinical management of the patients, the drugs, and other things that him and the team he is leading are using. And the head of the nursing staff did also give us some information. So this teamwork, which is represented here, looking after our patients well, is really a team the country is very proud of. The team has not been working alone. It has worked very closely under the direction of the Honorable Minister of Health and the Permanent Secretary and the Director General of Health Services and the Health Ministry. Again, that collaboration and cooperation and support by the Minister and her team is deeply appreciated by us and the country at large. Actually, at the helm of all this has been His Excellency President Yoweri Museveni, who in the early stages, even before COVID-19 came here, he saw the problem and called meetings to prepare for this monster. And it is true that when the monster arrived, it found Uganda fairly prepared to confront it. And the progress we have made as a country in the war against this pandemic is partly attributed to this foresight and early preparation. It is also true that His Excellency the President has been on regular times briefing the country, and as the Minister has said, 33 guidelines have been issued. But he has not only stopped there, he has done something which many people may not have realized, that he commanded the UPDF doctors to work with the Ministry of Health. And no wonder Lieutenant Colonel Dr. Chobe is comfortably working with you. It is because of the orders by the Commander-in-Chief for UPDF to come and work with you. So it's a combined team, and you can see what this combined team is producing wonderful results, in spite of the challenges that have been so well articulated by the Honorable Minister of Health. We have also been working with partners, and I'm glad that World Health Organization and CDC are very well represented here. We have not just worked with them now, but we have had long partnership as Uganda has been fighting against the various epidemics. We have been closely working with our colleagues in WHO as well as CDC. The next point I want to make, again, before I leave the President, is that the President has been concerned about patients and health workers, but has also been concerned about the conditions of the people. And the President has directed that food be distributed in Kampala, especially to the vulnerable groups. And in fact, he has further directed today that by tomorrow morning, he would like to see food distributed in all the divisions of Kampala to make sure that all the deserving people have something to eat, and has said there should be acceleration in the distribution of food so that we don't have casualties from both the virus and also from famine or lack of food. Therefore, the leadership of the President has been multifaceted, has handled a number of areas, but all this aimed at making sure that the disease is indeed defeated. The discharge of these 3 patients, as I have said, needs to be handled carefully. They have already said, by the way, give us space so that we walk out of the hospital properly without the press having to violate our privacy. I want to take this opportunity to appeal to our respective communities to warmly welcome these friends who have been discharged and integrate them properly, reintegrate them in their respective communities. After all, you have been assured by the minister and her team that these people have been properly treated and they have been given the requisite tests after treatment, and they have been clearly declared healed. So you have no reason not to reintegrate them in their communities so that they resume their normal life. Therefore, I'm happy that the Ministry of Health is taking extra measures to make sure that the communities are sensitized. And I would like, therefore, the RDCs, the mayors, the LOCs, to ensure that this process of reintegration is understood and the community is pacified so that there is no any hitch